My name is Hassan Msafiri, a student of London-Mtwara, where I've been here for 2 years for my clinical officer's studies, where I'll get a diploma in clinical medicine, and for this time I have 1 year to go to finish my studies. Okay. In Tanzania, we have about 5 training colleges for clinical officers, where at the end of the training we're just going to be sent to the dispensaries in the outreach areas to give the education, or also to treat the patients out there for minor cases of medical.
Okay, so you work closely with doctors?
At the outreach, you will not have some doctors. You'll be alone. You'll be in charge of the dispensary. But when you work at the hospital, you'll be with doctors and nurses who to support you on what you do.
So I think what you're saying is that for each age, there is the right set of information about sexual health for that age. And so maybe for contraception, maybe that you think it would be good to teach a slightly older age group.
And also, if it's possible, maybe you can make a short drama.
So you could, when you do your lesson plans, you might well do a short drama and ask the pupils to discuss it. I think we will work with you to develop the sort of lesson plan that you think is right for that situation. The hormone, when it's on the coil, is delivered very locally to the womb, to the endometrium, where it can do its job very effectively because you're putting it right where it needs to do its work.
You like 2 months more.
Yes, because this way in this class, you give us really short time. Only 1 week we've covered all of those contraceptives and a lot, even STIs we've covered. It's quite different.
The training program combines lectures, small group work and role play.
Whichever you like, yeah? Good. And then I want you to think about how it might be to explain this to a young person or to a parent.
Usually we are not taught like that. That you just stay on a basic.
Why might you need a female condom if you already have a male version?
It delivers up-to-date clinical and technical information.
And then what it's really good that we've all had a chance to feel what these things feel like.
It covers communication skills with an emphasis on working with young people and general relevance for use in clinical settings.
In theory, it's very different in practice. Okay?
The way the class conducted was much better. Yes. I can give an example. They taught us something concerning contraceptives and pills, combined pills, contraceptives. And they told us, okay, everybody take his partner, and one should be a doctor, one will be a patient.
So which one do you prefer?
According to what you were saying, can you explain more about
Kijiti pandikizi hiki wanapandikizia ni zoezi fupi tu la dakika 5, ila kinadumu kwa muda wa miaka 5 mpaka 7 tegemeana na aina gani ya kijiti kilichotumiwa. Sawa?
Our teaching methodology in Tanzania maybe is quite different from the way they use, because they even divided the class within the period. That means within lesson, some are discussing, then they come up with the answers.
Yeah.
Yes, they are trying what do they understand about it. Let's say something like contraception, even before introducing the subject. Then after that, they collect those ideas, then they come up with one thing which is most the good things.
What you do is, and then with the needle.
So there is a shape that's like a T shape, which is the IUD, coil.
This is not very like real skin, so it strips it too tight. In actual fact, it comes out quite easily. And you take the needle out and you leave your implant in the skin.
So you can focus it down, and also when you're talking to young people, again, you might want to focus your consultation down onto some that they've heard of, or ones that you think might be more appropriate for young people.
So for example, you might not discuss sterilisation with a young person because it's not going to be appropriate. And maybe the IUD will not be top of the list of what you discuss. So you make a decision also about what you think your patient might want.
The patient comes for the family planning consultation, they must have heard something. So what I think you must ask first, what are other family planning methods that you have heard about?